Hi, everybody. This is Dr. Brett Talley Daniel, MD, and I'm a neurologist and a headache doctor. And today's podcast is going to be on, does Ajovy help migraine? So Ajovy is fremanezumab, and it's a new calcitonin gene-related peptide. It's abbreviated CGRP for treating migraine. The migraine process generates three neurochemicals, neurokinin A, substance P, and CGRP. And these neurochemicals are released by the ganglia of the trigeminal nerve and cerebral arteries. They inflame the trigeminal nerve, the cerebral arteries, and the thalamus. And they also cause the cerebral arteries to dilate. The thalamus is the pain center of the brain, and the only migraine patients have inflammation of the thalamus like migraine does. So triptans, if taken early in the migraine process, that is 20 to 40 minutes after the headache onset, will block the release of these inflammatory neurochemicals and are currently the best drugs for acute therapy for migraine. But Ajovy is a preventive drug. So research involving cannulating the jugular vein and sampling chemicals of the blood as it leaves the brain has revealed that these neurochemicals are released by the migraine process. After migraine starts, there's an increase in the three inflammatory neuropeptides, and they go to the liver, then out of the body to the toilet. Ajovy blocks the activation of CGRP and is a new drug for migraine prevention. None of the older preventive drugs for migraine enter into the migraine process and work like this. So the question to be asked would be, does Ajovy help migraine? Yes. The FDA released Ajovy for use in the United States in August of 2018 and has had a grand success for migraine patients. But perhaps more interestingly, it is one of the first drugs developed specifically for migraine prevention, and three of these drugs have now been released. Ajovy is delivered as a subcutaneous needle injection at the top of the thigh or near the umbilicus and the abdomen. And it's given as a 225 milligram subcutaneous injection once a month. Or it can be given as 3 times a dose at 675 milligrams every 3 months. So you get 3 shots for 3 months and 1 shot for a month. What kind of injector is used for Ajovy? It comes with a pre-filled syringe and should be disposed of in a safe sharps container after injection. Are there any special precautions using Ajovy? Well, it should be stored in a refrigerator in its original carton to protect from the light, and the syringe should be left at room temperature 30 minutes before the injection. Seems to make it not hurt so much and to flow better. The thigh or abdomen should be cleaned with a alcohol sponge before the injection. Does Ajovy interact with other drugs? Well, most modern drugs are made from the dirt or plants in the world and then processed by drug companies and used to treat a specific illness. For instance, penicillin is a mold that accidentally dropped on an agar plate that Fleming had put on his window ledge. It was found to kill bacteria and later manufactured and sold to treat bacterial illnesses. Penicillin has 10 different drug contraindications, which means that penicillin should not be used with those listed drugs. However, Ajovy can be used with any drug. It has no drug-to-drug contraindication. I've been practicing medicine 50 years and never had a drug like this. Wow. Ajovy is made by DNA polymerization and then injected in the body. CGRP drugs are made like this, and DNA polymerization is a lab progress of spinning out strands of DNA, which is a completely novel method of drug production and safe regarding use with other existing drugs. What are the side effects of taking Ajovy? Serious side effects are hypersensitivity reaction, which is very rare. But common side effects are injection site reaction and muscle cramps or spasm. Unusual side effects are not very bad. So the injection site reaction is like a tiny bruise one will get from going to have your blood drawn with a needle in your arm for your doctor's visit. How about select safety information for Ajovy? Well, it may cause an allergic reaction such as itching, hives, rash, and trouble breathing. And this allergic reaction can happen up to a month after using the drug. Users are instructed to contact their health care provider or get emergency medical health care right away if they experience any of the following symptoms, which could be part of an allergic reaction: swelling in the face, mouth, tongue, or throat, or trouble breathing. Now, the serious side effects are very rare, and the common side effects are not very bad. Instructions for using Ajovy are online at https://www.ajovy.com/taking Ajovy. And I'll tell you all about it there. Well, what are the benefits from using Ajovy? Ajovy has a half-life of 31 days, and patients with a mean baseline of 12.8 headache days of at least moderate severity per month experience 4.6 fewer headache days per month on average with monthly dosing. Patients with a mean baseline of 13.2 headache days of at least moderate severity per month experience fewer headache days per month on average also. So I had a good response for this drug for treatment. And Ajovy is specifically developed for migraine. Historically, many migraine preventive medicines were designed for other conditions, but Ajovy was specifically developed to bind to CGRP, substance in the brain that plays a key role in migraine activity. Dr. Alan Rappaport, a clinical professor of neurology at UCLA's David Geffen Medical School, who's been a leader in headache research and treatment, said, "The most exciting thing about these drugs is not the FDA endpoints. The value of the CGRP class is its potential to significantly reduce migraines for a reasonable number of patients." And he says about 30% of patients may see 75% reduction, and between 15 and 20% may see a 100% reduction in migraine. This is an astounding result for migraine therapy, and much better than any of the results from previously used migraine drugs. So the previous standard migraine preventive drugs, level A from the American Academy of Neurology recommendations, are amitriptyline, topiramate, valproic acid, and the beta blockers, metoprolol, propranolol, and timolol. All these drugs work indirectly in the migraine process. And the older preventive drugs could reduce migraines about 30% in a month and had a lot of side effects that resulted in poor compliance so that many patients just quit taking them. Also, what about special cardiovascular and cerebrovascular risk? Well, Ajovy doesn't have that. Migraine, especially migraine with aura, has increased risk of cardiovascular and cerebrovascular risk. And the main acute therapy drugs, the triptans, are contraindicated here. But an increasing number of studies have shown that vasodilation is not so significant in migraine as thought, and that the new CGRP drugs are safe. Currently, the FDA says that Ajovy can be used in patients with cerebrovascular disease risk. All right, what about the new CGRP antibody drugs for pregnancy or lactation? There's no current indication for the use of the drugs for pregnancy or while breastfeeding. The FDA statement regarding these drugs is that pregnancy, there's a caution, is advised during pregnancy. No human data is available, no known risk of fetal harm based on animal data at the 20 times the recommended human dose. In lactation, caution is advised for breastfeeding. No human data is available to assess risk of infant harm or effects on milk production. So there you have it. Go to my migraine blog, please, online to receive some more. I have an article about this that has a picture on it regarding prevention of migraine with Ajovy, and that's at www.drmigraine, all one word, .com. And please click subscribe so we can keep in touch with each other, and I'll see you again on the next talk. God bless you all.